Hello guys, welcome back to Dr. Dental Smile Changes the Mood. So guys, in this video I will be sharing a clinical case of a crown placement on forceps after root canal therapy. So guys, watch the video till last and don't forget to like, share and subscribe the channel, and also click on the bell icon to get the notifications fast. So guys, a brief introduction about me. So I am Abhinas Jena, BDS final year student from Kalinga Institute of Dental Science. So if you are having any queries regarding Kalinga Institute of Dental Science, then you can directly contact to the director sir, Dr. Jugajyoti Pathi sir. The contact number is available in my description box. So directly from there you can contact him. Coming to the main topic of our today's video, so that is about the clinical case of a crown placement on forceps, that is mandibular right first molar. So basically the patient had undergone root canal treatment, that is RCT or root canal therapy, because the patient had a grossly decayed tooth, and there is no need of extraction also, because it was not in that bad condition that the tooth will be extracted. So the patient had undergone root canal treatment and had referred from the department of conservative and endodontic dentistry to the department of prosthodontics and crown and bridge. So if the patient will be not provided with the crown or will not be provided with the fixed prosthesis to that particular tooth, then there is a more chance that the tooth might get fractured. There is a more chance, and we can say that there will be increase in the risk of the tooth to get fractured, and as well as it may get again it may lead to secondary caries also. And if we will provide the crown to that particular tooth, then we will be not only preserving the tooth structure, but also it will help the patient for chewing also, and also will restore the function of that particular tooth. So coming to the tooth preparation, so my first appointment was on tooth preparation only. So we had followed all the principles of the tooth preparation for a mandibular right first molar. So we had given proper occlusal reduction to check whether there is occlusal clearance or not. We had asked the patient to bite by keeping modeling wax in between the upper and the lower tooth. So by that we had checked the occlusal clearance, as you can see here in the picture. So proper occlusal reduction has been done. Then properly we had given the taperness. We had not given more angulation, and we had tried to keep it as much parallel we can keep. Less taper is given, because if more taper we will be doing the more tapered preparation, then definitely there will be very less retention. There will be infinity path of insertion, and path of displacement will be there. Infinity path of displacement will be there also. There will be very less retention will be there. So that's why we are given very required amount of taperness is basically given. Then we had followed all the, like I had given the equigingival margin. I had kept equigingival margin there. We had given a camphor margin, not the shoulder margin. And because camphor margin gives more retention as compared to the shoulder margin, and also I had given a buccal groove in the buccal aspect of the tooth, little bit mesially I had given the retains buccal groove, so that there will be no rotational movement of the crown, and there will be proper displacement, proper retention of the crown. A porcelain fused metal crown has been selected for the patient because it has a good strength as well as it has good aesthetics also. So trying has been done, all the high points has been reduced, and then after the glazing of the crown is done, and the crown is cemented by using the luting type of GIC cement. The cementation is done only after checking the margin and the fitting and the adaptation of the crown with that of the tooth structure. So here you can see the final result or the final post-operative picture of forceps after the cementation of the crown on forceps. So here we restored the aesthetic, we restored the function, and we also preserved the tooth structure, and we also prevented the tooth from getting secondary caries or any kind of fracture. Okay, so at last I would like to say that this was my first patient. I had prepared this tooth for the very first time. It was my first case, and now I will be sharing with you that what are the things that I learned from my faculty and my professor, Dr. Sonali ma'am, who had guided me a lot for at the time of preparation. She checked each and every step and make me learn about each and every step properly, and I also followed all and each and every step the way ma'am said, and now I am more confident and I think I can do it in a better way also. So first we had, according to the book also, Rangarajan book, and also according to the ma'am, so first we had taken the potty impression, both heavy bodied and light bodied. Why to take the impression first before doing the tooth preparation? Because it will provide you adequate space for the flow of the light bodied putty material, as well as for the, it will also provide you the external outline form of the tooth. Then we will prepare the tooth using different types of burrs. I will explain it later in different videos. So after checking the proper occlusal clearance and proper proximal clearance and properly preparing the axial walls, so then I had given a buccal groove for the better retention of the crown. So after that I had sent I poured the cast, and I made the cast, and I had sent it to the laboratory for the fabrication of the crown. And in the second appointment I had done the cementation of this crown. And you make sure that while you are doing the cementation using luting GIC type of cement, then there should be proper dry area of the tooth. It should not be wet at all, otherwise it will not get burned with the tooth structure, and it may lead to contamination because of it coming in contact with the saliva. So guys, so before concluding the video, I would like to say that every root canal treatment will definitely become more success when a crown is given to that particular tooth. So without crown placement, without crown cementation, the root canal therapy may fail, because it may lead to fracture of that particular tooth, because now the tooth is non-vital, as well as the strength of the tooth is also deteriorated. So guys, thank you for watching this video, and don't forget to like, share and subscribe the channel, and also click on the bell icon to get the notifications fast. So here a good news for you all. So my first article, epidemiological evaluation of the orally potential malignant disorders, has been published in IJCPR website journal. So I will give you the link and also the PDF in my description box. There you can directly go through the article and just let me know how was that